FM.
Your number one news team covering the North. The Bahamas Tonight, Northern Edition.
Welcome back. The month of October is recognized as Breast Cancer Awareness Month, and during the month, many persons wear the color pink in support of the women who have fought the fight against the illness. Tonight, we talked to a women's physician who says breast cancer is not a death sentence, and she's encouraging women to pay close attention to their health. Jamila Mizik reports.
It is one of the most common cancers worldwide and the leading cause of cancer deaths in Bahamian women. Breast cancer can affect women at any age. However, consultant gynecologist Dr. Shamanique Bodie-Williams notes that the most common age group affected are women 60 years and older.
As we get older, we do have an increased risk of breast cancer, but we also have early breast cancer disease, which is found in ladies that are under 45 as well.
Risk factors include obesity, alcohol consumption, poor diet, and genetic history. Dr. Bodie-Williams notes that Black women tend to get breast cancer at a younger age, and it is usually more aggressive.
Depending on where the bad cells start from, that will determine what type of cancer that a lady has. And more commonly for ladies, it will usually start in either the lobules or the ducts. And so the signs and symptoms of the breast cancer would be if you feel any lumps or bumps in the breasts that are new, if you see any changes in the area that's around the breast, which is the colored area, the areola, or in the nipple. So sometimes ladies may have discharges coming from the nipple, and it can have a blood color to it. It could be clear, sometimes it could be white. In addition, that you see any changes in the color of the skin around the breast, that also is an indication that you should definitely see and discuss with your healthcare provider.
She says self-examinations are also important.
Definitely your annual maintenance would be once a year, and so that you would see your provider and they would do the exam. But I encourage my ladies to become familiar with your breast once a month, because your breast will change throughout the month. And I feel like if you get more familiar with it, if there's something different, that you would then be more likely to bring it to the attention of a healthcare provider who may see you once a year. And then once you see your healthcare provider, they will make a recommendation about your screening depending on what they think your risk factors are. And that screening, they may recommend it to start at 40, or they may recommend it to start earlier depending on your risks, and they may recommend it to be every year or every other year.
Now, the risk for breast cancer is about 1 in 8 women. In the Bahamas, there is a higher incidence of cases that are genetically related.
As we increase the awareness, it's empowering more women, and so as we become more breast aware, that we're getting to know the symptoms, you're getting to know yourself, and you're getting to know what questions to ask and keep up with your maintenance, it is definitely helping. And then we are improving survival, and we're making strides. So our 5-year survival rate is over 90%, and I think it'll continue to improve as we're able to detect cases earlier, have more frank conversations about this topic, and we're able to take charge of our own health.
Jamila Mizik, ZNS Network News.
Stay with us, our Facebook friend of the night up next.